Are you tired of the itchy eyes, runny nose, and constant sneezing that come with allergies? If so, you're not alone. Allergic reactions can be a real nuisance, impacting our daily lives and overall well-being. Thankfully, there are effective medications available to alleviate these symptoms, and olopatadine hydrochloride is one such solution. Olopatadine hydrochloride is a commonly used antihistamine that helps relieve allergy symptoms by blocking the action of histamine, a substance that triggers allergic reactions. This medication is available in various forms, including eye drops and nasal sprays, allowing you to target the specific area affected by allergies. With its fast-acting and long-lasting properties, olopatadine hydrochloride provides effective relief for a range of allergy symptoms, such as itching, redness, and swelling. Its effectiveness has made it a popular choice among healthcare professionals and patients seeking reliable allergy care. Whether you suffer from seasonal allergies, pet allergies, or other allergic conditions, olopatadine hydrochloride may be the solution you've been searching for. Consult with your healthcare provider to determine if this medication is right for you and experience the relief you deserve. How does olopatadine hydrochloride work? Olopatadine hydrochloride works by selectively blocking the H1 histamine receptors in the body. Histamine is a chemical released by the immune system during an allergic reaction, causing symptoms such as itching, watery eyes, sneezing, and a runny nose. By blocking the action of histamine, olopatadine hydrochloride helps alleviate these symptoms and provides relief to individuals suffering from allergies. The medication is available in two primary forms: eye drops and nasal sprays. Olopatadine eye drops target symptoms affecting the eyes, such as itching, redness, and swelling, while nasal sprays are used to relieve congestion, sneezing, and a runny nose. Both forms work by delivering the medication directly to the affected area, providing fast and targeted relief. Olopatadine hydrochloride is known for its long-lasting effects, allowing individuals to experience relief for extended periods of time. This makes it a convenient option for those with busy lifestyles who need reliable allergy management without frequent dosing. Common uses of olopatadine hydrochloride. Olopatadine hydrochloride is widely used for the management of various allergic conditions. Its versatility and effectiveness have made it a popular choice among healthcare professionals and patients alike. Let's explore some of the common uses of olopatadine hydrochloride in allergy care. Treating seasonal allergies with olopatadine hydrochloride. Seasonal allergies, also known as hay fever or allergic rhinitis, are a common allergic condition that affects many individuals during specific times of the year. Symptoms may include sneezing, a runny nose, itchy and watery eyes, and congestion. Olopatadine hydrochloride can be an effective treatment option for seasonal allergies, providing relief from these bothersome symptoms. The use of olopatadine hydrochloride eye drops can help alleviate eye-related symptoms such as itching, redness, and swelling. These eye drops are easy to use and offer targeted relief, making them a convenient choice for individuals experiencing eye discomfort due to seasonal allergies. In cases where nasal symptoms are more prominent, olopatadine hydrochloride nasal sprays can be used to relieve congestion, sneezing, and a runny nose. The nasal spray delivers the medication directly to the nasal passages, providing quick relief and allowing individuals to breathe more easily. Managing allergic conjunctivitis with olopatadine hydrochloride. Allergic conjunctivitis, also known as eye allergies, occurs when the eyes come into contact with allergens such as pollen, pet dander, or dust mites. This condition can cause uncomfortable symptoms such as itching, redness, and swelling of the eyes. Olopatadine hydrochloride eye drops are a common treatment option for allergic conjunctivitis, providing relief from these symptoms. The eye drops work by blocking the action of histamine, which is responsible for triggering allergic reactions in the eyes. By blocking histamine, olopatadine hydrochloride helps alleviate symptoms and provides relief to individuals suffering from allergic conjunctivitis. The use of olopatadine hydrochloride eye drops for allergic conjunctivitis is easy and convenient. Simply apply the recommended number of drops to each affected eye, as directed by your healthcare provider. The fast-acting and long-lasting effects of the medication can provide relief for several hours, allowing individuals to go about their day without the discomfort of eye allergies. Olopatadine hydrochloride for chronic hives and itching. Chronic hives, also known as urticaria, is a skin condition characterized by itchy, raised welts that can appear anywhere on the body. It can be caused by various factors, including allergies, infections, or autoimmune disorders. Olopatadine hydrochloride has shown effectiveness in managing chronic hives and relieving itching associated with the condition. The medication works by blocking the H1 histamine receptors in the body, reducing the release of histamine and alleviating itching and swelling. Olopatadine hydrochloride can be taken orally in tablet form for the management of chronic hives, providing systemic relief throughout the body. It is important to consult with a healthcare provider before starting any new medication for chronic hives, as they can help determine the appropriate dosage and duration of treatment based on individual needs. Olopatadine hydrochloride may be recommended as a short-term solution to manage symptoms, but long-term use should be discussed with a healthcare provider to ensure proper management of the condition. Potential side effects and precautions of olopatadine hydrochloride. As with any medication, olopatadine hydrochloride may cause side effects in some individuals. While these side effects are generally mild and well tolerated, it is important to be aware of them before starting treatment. Common side effects may include headache, dry eyes, mild eye discomfort, or a bitter taste in the mouth. In rare cases, individuals may experience more severe side effects such as eye pain, blurred vision, or an allergic reaction. If any of these symptoms occur, it is important to seek immediate medical attention. It is also important to note that olopatadine hydrochloride may interact with other medications or medical conditions. It is crucial to inform your healthcare provider about any existing medical conditions, allergies, or medications you are currently taking before starting treatment with olopatadine hydrochloride. Additionally, olopatadine hydrochloride is not recommended for use in children under the age of 3. It is always best to consult with a healthcare provider to determine the appropriateness of the medication for specific age groups. How to use olopatadine hydrochloride effectively. To ensure optimal effectiveness and safety, it is essential to use olopatadine hydrochloride as directed by your healthcare provider. The specific instructions may vary depending on the form of the medication, eye drops or nasal spray, and the condition being treated. However, here are some general guidelines to consider. Wash your hands before and after using olopatadine hydrochloride to prevent the spread of infection. If using olopatadine hydrochloride eye drops, tilt your head back slightly, pull down the lower eyelid, and place the prescribed number of drops into the pocket formed by the lower eyelid. Close your eyes gently for a few seconds to allow the medication to spread evenly. If using olopatadine hydrochloride nasal spray, shake the bottle well before use. Insert the nozzle into one nostril while closing the other nostril with your finger. Spray the prescribed dose into the nostril and inhale gently, repeating the process for the other nostril if necessary. Follow the recommended dosage and frequency of use as prescribed by your healthcare provider. Do not exceed the recommended dose unless directed to do so. If you forget to use a dose, use it as soon as you remember. However, if it is close to the time for your next dose, skip the missed dose and continue with your regular dosing schedule. Store olopatadine hydrochloride as directed, away from heat, moisture, and direct sunlight. Remember to always consult with your healthcare provider for personalized instructions on how to use olopatadine hydrochloride effectively. Alternative allergy medications to consider. While olopatadine hydrochloride is an effective allergy medication, there are alternative options available for individuals who may not respond well to this particular treatment or prefer different approaches to allergy management. Some alternative medications to consider include cetirizine, a commonly used antihistamine available in tablet or syrup form. Cetirizine provides relief from allergy symptoms such as itching, sneezing, and a runny nose. Loratadine, another popular antihistamine available in tablet, syrup, or dissolvable tablet form. Loratadine is effective in relieving symptoms of hay fever, hives, and other allergic conditions. Fluticasone, a nasal spray corticosteroid that helps reduce inflammation in the nasal passages, providing relief from nasal congestion, sneezing, and a runny nose. Montelukast, a medication that works by blocking the action of leukotrienes, substances involved in allergic reactions. Montelukast is available in tablet form and is commonly used for the management of asthma and allergic rhinitis. It is important to consult with your healthcare provider to determine the most suitable medication for your specific allergy symptoms and medical history. They can provide personalized recommendations based on your individual needs. Conclusion: the effectiveness of olopatadine hydrochloride in allergy care. Olopatadine hydrochloride is a versatile and effective medication for the management of various allergic conditions. Whether you suffer from seasonal allergies, allergic conjunctivitis, or chronic hives, olopatadine hydrochloride can provide relief from bothersome symptoms such as itching, redness, and swelling. With its fast-acting and long-lasting properties, Olopatadine hydrochloride is a popular choice among healthcare professionals and patients seeking reliable allergy care. Available in eye drop and nasal spray forms, it allows individuals to target the specific area affected by allergies and experience the relief they deserve. While olopatadine hydrochloride is generally well tolerated, it is important to be aware of potential side effects and precautions. It is always best to consult with a healthcare provider before starting any new medication to ensure its appropriateness for your specific needs. If olopatadine hydrochloride is not the right fit for you, there are alternative allergy medications available that may provide relief. Consult with your healthcare provider to determine the most suitable option based on your individual symptoms and medical history. Don't let allergies hold you back from enjoying life to the fullest. With the help of olopatadine hydrochloride and other effective allergy medications, you can manage your symptoms and experience the relief you deserve. Take control of your allergies and start living life without the constant discomfort and inconvenience.